if we look at our medical education system, we learn very minimal about just women's bodies in general. We learn about pregnancy barely, and that's where it ends. They don't get much about menopause training. We don't learn about much of what happens to the vulva and the understanding of the vulva changes throughout its lifespan. We don't learn anything. And we actually did a national survey and to confirm that, like, it wasn't just me and it wasn't just any one of my other fellow urologists that came out of this fellowship like radicalized. We all come out radicalized. And we come out radicalized because we're like,
you are all an entity of your own. Yeah.
What is happening? How is this happening? And so, I choose to combat this from several angles. I'm a translational researcher because of this. Like when I look at, so I went because I think the things I care so much about it is because this lack of resources, the lack of everything directly affects human beings. Yeah. It's not like, oh, there's these huge gaps in knowledge and ignorance and all this stuff, and everyone's fine. If we look at the stats of women just in general, gynecologic outcomes, all these things, they're abysmal. And there's a reason why they're abysmal. And I think it's so important to speak truth to power. Like, I think we always want to be like, oh, but I'm like, no, I'm not here for bullshit. Mm-hmm. I want the facts. I want the knowledge. And so looking through the literature, I realized that there was not much. There's not a lot. There was a really big renaissance in the mid 90s, early 2000s. And then the WHI study came out and there's just a huge paucity of research. And so just looking at that, my job in research is to start debunking myths. So I defined how many nerves, my research group and I defined how many nerves are in the human clitoris. Y'all, we're still defining anatomy. Like we're working on defining other parts of the vulva this year and like putting out grants and all this stuff. And like, this is where we're at. We're starting at like numero uno. Like there is work that has been done, but there's still so many gaps in between those work. So that's one thing. And then two, our education system is trash. Like, and the organizations that are meant to advocate for these, AMA, AAMC, they're not doing these things. And because there's no one that has done the research to prove these things. Anyone that works in women's sexual health knows this. They know it inherently, they know it deep in their bones, but because it's not documented, because it's not peer reviewed, there's no data, people don't believe it. And so that's another reason why I do research. It's a means of advocacy. Me sitting here and hearing over 2,000 stories of medical neglect and malpractice, truthfully, doesn't mean anything unless I write it down. And so those stories, I do research, I kill myself doing research as a means to be like the voice for my patients. Yeah. As a means to be the voice for all of women that don't get their ability to say what they need to say, right? And also, knowing the lack of what I know and how confidently we are ignorant in the medical field, like that makes me also tell my patients, you are your own biggest healthcare advocate. Do not let them tell you what you should and should not be getting based off of not facts. So many doctors will dismiss women without knowing the evidence. Like if we look at just hormone replacement therapy, as soon as I say that word, hackles come up, not only from patients, but from doctors. And from patients, I can understand because you're not in the medical field, you're not in the world, you're not looking at evidence-based research all the day. I hope not, because that'd be
that's what these conversations are for.
I actually do research. I actually want people to be doing research, but doctors should be. As that is part of our Hippocratic oath. And yet, so when a hackle comes up from a doctor, I'm like, show me the data. Show me the actual data of where you are getting this fear from. And then they'll always quote the WHI study. And I'm like, did you actually read that study though? Right. Because if we actually look at the study, it actually shows that it's safe. They just did the study wrong. And so it's like there's this interesting thing when it comes to women's health of just like, it feels like doctors are just playing a game of telephone. They like heard hormones were dangerous, but like they didn't do the research to actually prove it. And if we actually look at the research, it shows that it can be safe when done safely. And so these are the doctors that are the gatekeepers for your health. not your quality of life, not just your quality of life, but your actual health. Why is it that we know estrogen is so protective for the heart, and yet when women go through menopause,
Yeah.
the first one of the things that happens is that they get heart disease.
Yeah.
Why are we not putting
Why
two
are
and
we
two
not putting that
like,
together? Yes.
why
Yes,
are
yes.
like what is going on? It's a selective ignorance when it comes to women, and I hate it because this is not happening at all in men. And I get to actually see both. I treat all genders. I get to advocate for all genders because there's definitely things on the men's side, the trans side, all these things that are need to help. But it's like if we were to even compare, like this is where the science is for everyone else, and this is where the science is for women. And it's just so infuriating because this is legitimately leading to death.
It's
Like,
absolutely preventable.
and it's absolutely preventable. So I tell patients, arm yourself with your own research, like with your and this is the hard part is because how do you find that research? Where do you get it? That's what I'm building. But arm yourself. You are your own biggest healthcare advocate until the medical system chooses to actually start taking care of women and people with vulvas well and through evidence and science-based information. You are going to be your own biggest advocate. And so many people are surprised by this. I'm like, don't know.
Yeah.
This
Yeah.
is truly what's happening out in the world.